I think that the role of UNA, in my perception of it over the years, has been with our PRC committees allowing us to express our concerns about safety of the patients, but also in the Health and Safety Committee, the safety of the staff. And over the years, I've really seen it come in with the lifts that we have, although we don't have enough of them, we do have lifts. In my own hospital, we have a transfer team, a lift team, so to speak. And I think that has cut down on the back injuries and shoulders injuries considerably. And that has only come through UNA, that, we go to the committees and we say, look at the rate of back injuries. We've got to do something to prevent this. Look at the patient safety issue. We can't have 3 patients in our TV lounge. And in fact, blocking the fire doors. If there's a catastrophe, we are in big trouble. So, and I think that on my own unit, from my experience with UNA, I can push the button all the time on my manager. Come on, we got to do something about this. We can't carry on like this.
You've touched on this a little bit, but let me just ask you to go into it a bit more. Are there some underlying problems in your workplace that lead to what you would sort of term as unsafe situations? Overwork or whatever?
Definitely overwork. I was actually saying to my manager the other day that she should not be calling full-time people for overtime. They're already working full out. They need their time off. That, call the part-time people first, or whatever. If you can't get a casual in, do that. But we're using a lot of sick time now, more sick time than I've seen for a while. There's more irritability with the staff because they can't get done what they need to do, the pushes on. And most of the time my unit is in triple overflow, okay? Triple overflow is not safe. It's in a TV room, lounge. There's no oxygen in there. There's no, it's isolated. There's furniture in there. There's 3 beds in there. They have, if you believe it, they have a doorbell system that if they press the doorbell, the little button in the room, then the doorbell rings out of the nursing station. It's not safe. We have overcrowding in our hallways. We have stretchers on both sides of hallways. That's not supposed to happen because there's no storage room. We have lifts in the hallways. We have isolation carts. Now that's the big thing. We are really into this MRSA infection rate that isolates patients. So I think we have 7 or 8 single rooms isolation. Well, we use them for isolation rooms. There's a cart out in front of every room. So you've got carts, you've got stretchers, you've got IV pumps, you've got blood pressure machines. If we ever had a fire there, it would be a disaster. I'm at my manager all the time. So I come in the next day and it's all tidied up. And next day after that, it's all back there again because there's no place to put it. And you need all that equipment. It's not as though it's excess. We need it. So very, very dangerous.
So what do you think needs to change to make that situation less bad?
I don't know if they can change this situation now. Well, we could not have 3 patients in a TV lounge to begin with. As far as the stretchers and everything, it just needs the manager to be out there looking at things and saying to the staff, to the auxiliary staff, you have to tidy up this place. We cannot have stuff on both sides of the hallway. It's against the fire regulations. And in fact, one of my nurses did call the fire marshal, and the fire marshal came up and looked around and said, you can't do this sort of thing. And it was a Friday, and the fire marshal came on Saturday and reamed out the charge nurse, who didn't even know anything about this whole thing. And of course, when the manager came in on Monday, she was really upset because this other person had called the fire marshal. And I said, you can't reprimand her for that. She's doing her job. This is not safe. She's thinking of patient safety. If there was a fire, we'd never get anybody out of here, you know. So I think you need a real commitment from management to do what they're supposed to be doing,
Right.
you know, to fix the situation. But I don't know.
No, I mean, I think that.
And I have actually quite a good manager, but it just seems like, you know, she doesn't have a whole lot of control of the situation either.
Well, yeah, there's some underlying stuff about health boards and all of that kind of thing, obviously.
Well, the whole hospital is in triple overflow. You read stuff in the paper about how they're getting the patients out of the emergency department, you know, the waiting time, blah, blah, blah. Well, they are getting them out, but it's to the detriment of the nursing units because we have like 3 people in overflow. We have two patients in a private room that only holds 1 patient. Pretty soon we'll have damn bunk beds. I don't know.
What's UNA's role in the situation you were describing? I mean, as I understand it, there are some kind of, you know, patient-nurse ratios and stuff that UNA tries to enforce, but when the situation's that out of control, as you're describing it, and you're not the first person who's described this triple overflow to us, I mean, how does UNA act in that situation? How can they do something?
I think that UNA to control some of these situations, we really need to work on getting some kind of legislation about nurse-patient ratios. I know they have it in California. I know there's several of the states that have it, and that's really what we need. Yeah, there are lots of mistakes. There are lots of medication errors out there that you don't even know that you did it. You think that you gave the right medication, the right dose, etc., to the right person, and sometimes you haven't. You know, fortunately, there's no big outcome, but I may never know that I did that. Someone else might pick up that something happened, or it might go completely unnoticed, and it will go unnoticed unless there's some kind of adverse effect. That's unfortunate, but that's what happens. But on the other hand, if the incidence of medication errors are going up and people are reporting them, filling out the sheets, and they're not being used as a punishment for somebody, that's an indication that there's too much going on. The workload is too heavy that people cannot practice in a safe setting.